Scene script. Have you ever wondered why your urine changes color? What if it could tell you something about your health? Let's dive into the mystery of urine color. A fascinating fact is that urine color can change based on a variety of factors. It's not just about how much water you've been drinking. Imagine your urine as an artist's palette, with colors influenced by hydration levels, food pigments, and even certain medications. Let's start with clear urine. Crystal clear, like water. You might think this is a good sign, a testament to your hydration, and you could be right. But be aware, overly clear urine could also mean you're drinking excessive amounts of water. On the flip side, it could be a signal that your liver isn't functioning as it should be. Moving on, let's talk about the standard color of urine. It's generally a shade of yellow, ranging from light, pale yellow to a deeper amber hue. This spectrum is primarily determined by your hydration level. The more water you drink, the lighter your urine color. Conversely, if you're not drinking enough, your urine could take on a darker amber color. But what about those times when your urine glows with an unusual color? Perhaps a neon yellow that could practically light up a room? Before you start worrying about radioactive waste, consider this. Certain B vitamins are notorious for causing this glow-in-the-dark effect. So, there you have it. Your urine color isn't just a random occurrence. It's a fluid reflection of what's happening inside your body, the foods you eat, the medicines you take, and your hydration level. Just like a personal health barometer, your urine color can give you a heads up about what's going on inside your body. So, what are the different colors your urine can turn into, and what do they mean? One of the most common color deviations you might notice is a neon yellow hue. This can be caused by an intake of B vitamins. These essential nutrients are water-soluble, and your body will flush out any excess through your urine, hence the vivid color. It's nothing to be alarmed about, but it certainly can be a surprise if you're not expecting it. Next, we have orange urine. This can be a little startling, but often it's simply due to certain foods or medications you've ingested. For instance, the pigment in carrots or vitamin C supplements can turn your urine orange. However, it's also important to note that some medical conditions like liver disease or dehydration can also cause this color change. So, if you're seeing orange and haven't been munching on carrots or popping vitamin C, it might be worth a trip to the doctor. Now, let's talk about a color you might not expect. Blue. Blue urine is quite rare, but it can occur. This can be due to certain dyes in your diet or even a rare genetic condition known as familial hypercalcemia, which is also called blue diaper syndrome. If you're seeing blue and it's not due to a blue raspberry slushy, it's probably best to consult a healthcare professional. Lastly, we have dark brown urine. This is usually a sign of dehydration. Your body is trying to conserve water, so your urine becomes more concentrated and darker in color. Increasing your water intake should resolve this, but if it doesn't, it could signal a more serious condition like a liver or kidney issue. Remember, your urine color is a sign language. It's time we learn to interpret it. But what if your urine isn't just a different color? What if it's cloudy, foamy, or red? Now that's something to ponder upon. Let's delve into what these peculiarities might mean. First up, cloudy urine. It might seem alarming, but it's often caused by various factors. It could be due to something as simple as dehydration or a urinary tract infection. In some cases, it might indicate kidney stones. It's like a cryptic message from your body saying, hey, something's not right here. Next, let's talk about foamy urine. If you've ever poured a beer too quickly and seen the foam rise up, you'll know what we're talking about. This isn't about a poorly poured pint, though. Foamy urine can be a sign of something far more serious: kidney failure. Your kidneys are like the body's cleaning crew, and when they're not functioning properly, proteins can slip through, creating a foamy appearance in your urine. It's like a distress signal from your kidneys saying, "We need backup." Now imagine looking down and seeing red. No, not from embarrassment, but in your urine. While it might give you a bit of a shock, don't panic just yet. Red urine can be caused by eating certain foods like beets or foods with dyes. It could also happen after a strenuous exercise due to the breakdown of red blood cells. However, if the red color persists, it could indicate a more serious issue like a urinary tract infection or kidney disease. So as it turns out, your urine does more than just eliminate waste from your body. It's like a daily health report, giving you updates on what's happening inside your body. And while it might seem a bit odd to pay so much attention to something so, well, mundane, it's actually a vital part of understanding your body and its intricate workings. It's fascinating, isn't it? How a simple trip to the bathroom can reveal so much about our health. So, when should you be worried about your urine color? This question is a vital one to answer, as it can mean the difference between a simple dietary change and a serious medical condition. Let's start by understanding that urine color can vary based on a number of factors, including hydration level, food pigments, and medications. It's completely normal for your urine to shift hues throughout the day. The standard color of urine is light yellow to amber depending on hydration, but don't be alarmed if your urine is neon yellow after popping a B vitamin supplement. Even consuming certain foods like beets can turn your urine red, while some medications might tint it orange. However, the key point to remember here is that these color changes are temporary. Your urine should return to its usual color within a few days. If it doesn't, that's when you should start to take note. For instance, dark brown urine could indicate dehydration, but if drinking more water doesn't lighten the color, it could be a sign of liver problems. Similarly, foamy urine might just mean you've urinated quickly, but if it's a consistent occurrence, it could indicate kidney failure. And then there's the rare blue urine. While it could be related to diet or a genetic condition, if it persists, it's definitely something that should be checked out by a healthcare professional. It's also worth noting that cloudy urine, while often caused by harmless factors, can sometimes be a sign of a urinary tract infection. In such cases, you might also experience other symptoms like pain, fever, or a burning sensation during urination. So if you notice persistent, unusual urine colors, especially if accompanied by other symptoms, it's time to seek medical help. It's important not to ignore these signs, as they could be indicative of underlying health issues that need to be addressed. Remember, your body is an intricate system, and every part of it, including your urine, plays a role in maintaining your health. Your urine is like a mirror, reflecting what's happening inside your body. Don't ignore its signals. So, are you ready to become more urine color aware? It's time to take charge of your health. And it starts with something as simple as paying attention to the color of your urine. From clear to amber, neon yellow to orange, each hue carries a message, a signal from your body. Perhaps it's saying you're well hydrated, or maybe it's hinting at a need to cut back on those B vitamins. But don't let the colors scare you. Most shifts in urine color are temporary, influenced by what you eat, drink, or the medications you take. However, persistent unusual colors may be your body's way of waving a red flag, asking for help. So, here's your challenge. Be conscious of the color spectrum in your toilet bowl. If you see anything out of the ordinary, don't hesitate to consult a healthcare professional. It's about developing a habit, a routine of being in tune with your body, understanding its language. Remember, your health could be a urine color away. Don't ignore the signs. Take the urine color challenge today.